Good afternoon, folks. This is Robert Chapo, executive editor of Madison365, for your with your daily update for Thursday, May 20th. Today we have a very special guest. We have Dr. Jasmine Zapata, who's the new chief medical officer in the Bureau of Community Health at the Department of Health Services, talking about community health, what that means, her opinion on vaccines and on COVID spread and the situation right now. So it is, we'll get through the rest of the news pretty quick because that is an important interview to get to. I would recommend, if you have some time tonight, give a listen to this Real Talk with Henry Sanders. It's on the website at madison365.org/real talk. If you're from Madison, you know Shiva. If you're not from Madison, you should know Shiva. She was been on the city council for a long time. She's her journey. This Real Talk season is all about people's journeys and how they got to where they are. But fleeing Iran during the revolution to Spain, getting to Belgium, where she had to raise her brother, getting to California, finally getting to Madison, where she's been now for over 20 years. It's a fascinating story. Give it a listen. It's at wherever you get your podcasts. Just look for Real Talk with Henry Sanders. Let's talk real quick about the COVID numbers for today. We're going to keep this really short because there's not a lot to report. The news is good. It's 448 new cases today out of 3,780 new tests. So about almost 12% of those are positive, which is where we've been. The better news, though, 2.7% of all the tests in the past 7 days have been positive. 2.7%, which is great. Yesterday was 2.8, so it's down. It's still below 3.0. That's right where we want it to be. Vaccines continue to be slowly getting delivered. We are now over 40% completely vaccinated for the state, 40.1%. 46% have at least one shot. So that's pretty decent news, actually. About halfway to where we need to be to get herd immunity, right? We're still doing less than 22,000 shots per day. We'd love for that to be higher. We'd love for more people to be jumping in and getting that vaccine. But Dr. Zapata will talk a little bit more about that as well. We also report today 2 fatalities. And our 7-day average now for fatalities is all the way down to 4, which is the lowest I think it's been. It's been at 4 a couple of times, but it's usually much higher than that. So that's, again, decent news. Let's talk real quick through some other news today that we have on the website today, madison365.org, and then we'll get to our interview with Dr. Zapata. It is where's my graphic here? Here we go. You remember the murals on State Street last year? We got 2 stories about those murals, kind of coincidentally happening at the same time. Oscar Morales, the principal at Omega School, former poet laureate of the city of Madison, arts guy, really community leader, has put together this website called Madison Murals that kind of captures a lot of those murals digitally, so you can take a look at those, because a lot of those murals have come down now, right? You remember what I'm talking about, the State Street corridor and all around downtown last year. People put up boards and stuff to protect the windows from the protesters, and then they became a public art project. And this website preserves a lot of those images, but also has some curriculum attached to it, so you can start a conversation about what these murals are about and what they're for. Speaking of those murals, there was a book, American Family Insurance, at the suggestion of Judge Everett Mitchell, put together this book. It's a big, hefty 400-page coffee table book. And it captures a lot of those murals, as well as the artists, has the artist statements in it. The artists were really involved in this book. And that book won a bunch of indie book awards. This is an international competition. It was a finalist in several categories. It was 3rd place in the grand prize for best overall book. So that's really impressive. And I've got a story on that. I've got quotes from Naira Jordan, who is kind of the project manager on this, and so on. So that's it was very exciting, and congratulations to everybody involved in that in that effort to bring home those awards. Take a look at that at Madison365.org right now. In sports, Derek Gebhard, you remember he scored that game winner in stoppage time last Saturday. Big, dramatic last-minute goal to win the game. The goal itself wasn't, it was a very easy tap in, but it still won goal of the week for the USL League One because it got 65% of the vote because Madison fans are that's what they do. They just get it, and we're going to vote, and we're going to get this guy win. So Derek Gebhardt wins goal of the week in the league, which is really cool and exciting. Finally today, UW Health. This is a white privilege story. When I go to the hospital as a white person, it does not occur to me that I should think about shampoo, right? I just know there's going to be shampoo there and it'll be fine. But if you're black, anybody black watching knows this. Like, there's a whole other set of shampoos and things. Like, when people put shampoos in hospitals and hotels, it's just like white hair is the default and the normal hair. So that's the shampoo they put in there. UW Hospital recently, a patient said, "Where's the shampoo for me?" So these couple of nurses put together a drive. They went through all the committees and the DEI committees and the diversity committees, and they got proper black hair care products placed at UW Hospital. And Malik Anderson has that story up on Madison365.org right now. All right, that's the news. Metcalf gets a free ad because the graphic is still there on the slideshow. We're going to take a short break. When we come back, Dr. Jasmine Zapata will join us, talk all about community health, public health, COVID, and vaccines, and all sorts of stuff like that. Don't go away. We'll be right back after this message from UW Health.
Here in the Midwest, community is important.
Having a healthcare system that's looking out for us,
that's actively addressing the racial disparities in healthcare is important.
When we can get good quality care, we can do more. We can achieve more.
We can be the kind of community we want to be, and that's really important.
UW Health. Remarkable medicine. Remarkable care.
And joining the program today, Dr. Jasmine Zapata, the new Department of Health Services Chief Medical Officer. How are you doing today?
I'm doing well. Thanks for having me.
Thank you so much for being here. Can you, and congratulations on the new job. This is a big deal. Can you just give us a quick job description? What is your new job entail? What does the Chief Medical Officer do?
Yes. Again, I'm Dr. Jasmine Zapata. Some people call me Dr. Jazz. You could call me whichever one of those you would like. And I'm the new Chief Medical Officer and State Epidemiologist for Community Health within the Wisconsin Department of Health Services Bureau of Community Health Promotion. And a lot of people say, what in the world is a Chief Medical Officer? What is a epidemiologist? And I'm just so excited to have the opportunity today to have that conversation with you. As far as what an epidemiologist is, really, it seems like a big word, but really what it means is a disease detective. So detectives go investigate things and get to the root cause of problems. What I get to do in this exciting role is be a disease detective and go and look at what are the current issues concerning our community, what are the current diseases and public health problems, and how can we keep track of those things, but also how can we prevent them? How can we get, from a prevention standpoint, get to the root cause of what things in our society, what social determinants of health, what things play a role, and how can we prevent them in the first place? So I am just so excited. And in the Chief Medical Officer role, really what that entails is being able to provide public health consultation and leadership and advice to different programs within the Department of Health Services and within the Division of Public Health and especially my Bureau of Community Health Promotion, but also working with community partners, our community and tribal partners, to give public health consultation as well, develop community partnerships, and really listen to the voice of the community, listen to what public health issues are impacting you, and me taking that information and within our Department of Health Services, finding solutions and advocating for what things that we can do to help everyone in Wisconsin live their best life.
Now, you say like, epidemiologist is a word that a lot of people maybe didn't know or hadn't heard a year and a half ago, but now it's like everybody's an epidemiologist on Facebook.
Everybody hears that.
So
yes.
And given that, and given like chief medical officers within the DHS was a relatively obscure sort of bureaucratic job probably at one point, but it is now kind of a really public thing. How aware are you of that, and what does that help you that everybody now knows who to talk to about the state health stuff, and or is that a burden? Is that a challenge?
Mm-hmm. Great question. COVID-19 has had many devastations, but one positive thing out of the situation is it really did put public health on the map. Traditionally, across our nation, public health departments are underfunded. There's more compensation and more money devoted toward helping people after a problem occurs or after someone's already sick, but there's not that much funding or priority for prevention and public health. But now, with what has happened with COVID-19, we are seeing that prevention and public health is very important. So in some regards, I am disappointed, and I am so horrified by the devastations that the COVID-19 pandemic has had on our state, but it's also been an opportunity to really highlight the importance of public health and why positions like this are so important.
And you're also, you have a perspective that maybe is underrepresented in medicine generally, and in public health as a Black woman taking on this job. What does that what do you bring to the table just from that identity and that lens?
Thank you so much for that question. The things that I advocate for and that I fight for and that I speak up about, a lot of them are rooted in my lived experiences or the lived experiences of my cousins, my aunties, my uncles, my church members, or young children that I've met through community choirs, and from lived experiences from myself and others in my community. And so, especially living through some of these things, I'm able to bring that lens and perspective as I am in board meetings or important policies and decision-making tables, where I can take that lived experience and really be a voice to some of the policies and some of the decisions that are being made. Bring that narrative perspective to it.
Because we know that, racism has been declared a public health crisis here in Wisconsin and Madison and in Milwaukee and places all across the country. So what do you think, as the epidemiologist for community health, what are the couple of things where racial disparities are really either the most stark or maybe the first ones that you want to try to address? Yes,
that's a great question. There are many racial inequities that we need to address in our state. So there's going to be many priorities I have, but one top priority will be in the field of maternal and child health. Right now in Wisconsin, Black babies die at much higher rates compared to white babies. And also, we have an extremely higher Black maternal mortality rate compared to the white maternal mortality rate. There's also inequities in our Indigenous populations, our Latinx population, as it relates to maternal and infant mortality. And even if the babies and mothers survive, we still have horrible inequities as far as birth outcomes and adverse birth outcomes for the mothers. So this is a public health crisis that we definitely need to continue to advocate for. So those are going to be some of my top priorities in this role. Within the Bureau of Community Health Promotion, there are a lot of amazing things going on to support mothers and babies. We have our WIC program, which there's a lot of amazing things going on there, especially in the area of in the era of COVID-19, being able to allow telehealth visits and educational support as far as nutrition. Also, we have in Wisconsin a maternal mortality review board where all of the maternal deaths are reviewed, and areas where the death may have been able to be prevented are identified, different strategies for prevention. So there's a lot of opportunity, even with that maternal mortality review board, to really be more vocal about some of the findings that are there. There's going to be some reports coming up from that I'm hoping to really amplify and help to make that review process even more community-based and inclusive. In addition to that, something else great that is happening in our bureau is that Kenikia Terry is the director and is leading an amazing new unit called the Maternal and Infant Mortality Prevention Unit. And so that is the first of its kind really in our bureau, and we're planning to do some amazing things with that as far as bringing awareness to this issue. That's just one. There are so many other public health issues that I'm planning to address, but that is just one example of racial inequities that we see and specific ways that we can work to address them.
Can we talk a little bit about just your background? Correct me if I'm remembering this wrong, but you're a pediatrician in practice?
Yes, great question. Right. I'm actually two type of doctors. I'm board certified in pediatrics. So I actually still work clinically at the hospital. Yes, and I run to deliveries. I resuscitate babies that come out and they might not be crying or breathing as they should. I round with new birthing people, and I help to do procedures on little babies that are requested by the parents. So I'm a pediatrician, but also the other specialty that I'm board certified in is preventive medicine and public health. We know that only 20% of health outcomes are based on things that happen in the hospital and clinics. The other 80% is based on social economic factors, individual health behaviors, your environment. So in my preventive medicine and public health training, it really looks at how can we get outside the clinic walls to really impact the social determinants of health. And so those are my two specialties as a pediatrician, and also promoting health across the entire lifespan as a preventive medicine and public health doctor. So I'm so excited to bring those two specialties into my role as chief medical officer for community health.
My next question was going to be, how do you go from, pediatric practice to public health? But it sounds like you never did. You're just doing both this whole time, right? And how did you? At what point did you decide, like, I'm going to be a doctor? I'm going to be a pediatrician, and I'm going to focus on public health?
Ooh, that's a good question. You need to invite me for a whole day long of a segment so I can tell you my whole life story. But what I will say is, ever since I was 5 years old, and I have proof of this, ever since I was 5 years old, I said I wanted to be a doctor. My parents got me a book when I started kindergarten, where every single year you would put who your favorite singer was. You put your best friend's name, your favorite topic in school, and then you also had to check a box on the bottom of what you wanted to be when you grow up. So when my parents gave me this book in my adult life to look at, ever since kindergarten, I checked the doctor box. I don't know what I was thinking back when I was 5 years old, but I've always known I've wanted to be a doctor. And over the years, it really solidified that desire really solidified inside of me due to various experiences with people in my family with health issues, particularly my little brother, who was diagnosed with epilepsy when I was about 11 or 12 and he was about 8. When we were in the hospital room and they were trying to do all kind of tests to help him, I always remember the doctors would be outside of the door talking in a very serious conversations and figuring out what was going on with my brother. And I said at that moment, I need to be out there with them, figuring out what's going on with my brother so we can protect him and we can figure out what's going on. So that was when I was younger. And then various other events happened over the course of my life that really solidified my desire to be a doctor and to help people and figure out the different health conditions that they were facing and solutions. However, when I got to medical school and when I started my pediatrics training, when patients would come in the hospital or clinic, I would start to feel limited in what I could do. There's only so much medication you can give to help someone when we have one of the highest inequities in our criminal justice system, and we have our racial wealth gap, and we have disparities and inequities in our graduation rates. There are so many social factors that impact one's health that I felt limited just as a medical doctor seeing patients in clinic. I said at that moment, I need to figure out a way that I can get outside the clinic walls and impact people's health holistically in a radical way. I want to own property. I want to be the landlord. I want to go talk about reforming our education system. I want to talk about criminal justice reform, because all of those things play a role in people's health. So long story short, that's my kind of winding path from being a doctor to then, in addition to that, entering into public health leadership. And I am so excited to be where I'm at today.
That is fantastic. And then what I hear you say is that when you, if you're seeing somebody who's really sick, whether it's a kid or just a person, like in some ways that's too late. Like you wanted to be impacting their lives before they get to the point where they need medical intervention.
Exactly.
Right? That makes a lot of sense.
Exactly.
So I just want to ask a couple questions real quick about the current situation we're in, because we are, doesn't feel like it to everybody anymore, but there is still a pandemic going on.
Yes.
Right. We have basically the last of the health order restrictions expiring in the next couple of weeks. Are you comfortable with that as a public health doctor?
As a public health doctor, I am very excited for the progress that we have made. We're doing very well as far as our vaccination rates. There are some areas that we can improve on and some groups that we want to see the numbers a little bit higher in, but I'm very excited that the vaccines are working. We know that the vaccines are safe and effective, and we're actually starting to see the manifestations of that with being able to relax some of our restrictions. From a personal standpoint and as a medical doctor, I have seen the devastations that this last year has had on our community, not only our physical health, but economically, spiritually, emotionally, mentally. And so I'm very excited to be able to have our community get back to some of the activities that we were able to enjoy before COVID, because protecting our emotional and social well-being is critically important for our overall health. So I am cautiously excited about the future. We still have a lot of work to do, and we need to stay vigilant. If there are those who have not received the vaccine, we should still be having conversations about getting the vaccine. We should still be washing our hands for 20 seconds, still be masking up in certain situations. If you are in schools, in homeless shelters, in certain detention facilities, if you are around children who haven't had a chance to have the vaccine, there's still some situations we should be masking up, but and staying safe. But I am hopeful about the future.
And how do we get more people vaccinated? I know there are some who are just kind of hesitant. Some have significant barriers, like transportation barriers, language barriers, and that kind of stuff. I know the state DHS is working hard to overcome those barriers. But I think there's a lot of people who are just like, I'll get around to it. And now that everything seems to be fine, maybe they never will. How do you get past the complacency, I guess?
That's a great question. Continue having conversations, especially with trusted messengers, people that you trust. Continue having conversations about this. And I'm always available. I let everybody know if you're having a Zoom event, a conference, a community conversation, a media opportunity, invite me here to have it. I'm happy to have those conversations. We do have to respect that for many reasons. There is, in some cases, a distrust with the medical and public health system, and we acknowledge that. And my personal approach has been to not shame anyone who has not made the decision to get the vaccine yet, but to just know that we are here to continue having conversations. If you have questions, if you just need to process your decision, we're here to talk about it. So that's been my personal approach, just to have continued conversations. And especially for those who are still on the fence and thinking about it, anything that we can do to just move you one step closer, then that's great. And just keep having conversations so that people can make the best decisions for them. We know that the vaccines are safe and effective, and they are a very important tool in our toolbox to be able to make it out of this pandemic, which is historic. Nothing like this has happened for the last 100 years, but we're going to do everything that we can to get through this together. So let's keep having those conversations and talking about it.
Last question for you. Like you say, nothing's happened like this in over 100 years, and just we had to do so many things so differently for this past year, a little over a year. And some of those, I feel like some of those things that we've changed are going to kind of stick. Is there anything in your realm, in the public health realm, or in the healthcare realm more generally, that is being done differently this year that you think should stay or will stay, having changed permanently because of COVID? Do you know what I'm asking?
That is a great question. I know what you're saying. One thing interesting that I've heard is that our goal shouldn't be to go back to normal, because the life that we lived pre-COVID, there were many inequities, there were many problems going on. Our goal should be to create a new and better normal coming out of COVID-19. So with that being said, so going to your question, a few things that I see that we might be able to take and learn from COVID-19. Number one, we saw that over this winter season, the amount of flu hospitalizations and deaths in children and adults significantly went down. And we believe that that is in part due to all the masking, and then also the vigilance with hand washing and social distancing. So that is a lesson that we can learn, and everyone is looking into that to see what lessons can we learn from this past winter and take into the upcoming flu season. That's one. Also, there's a lot of interest in learning more about the benefits of being able to work from home and doing meetings electronically. That has saved a lot of time with rushing to, I know for me personally, rushing all around town to different meetings, finding parking, running in, getting stuck on the elevator. So there's a lot of question about productivity in the virtual space. So that's going to be something interesting to look into. And then another great thing that we are going to take and learn from this is that we need to be prepared for the next pandemic. And we need to take the health inequities, especially with COVID-19, how we saw some of our communities of color being disproportionately impacted from COVID-19 hospitalizations and deaths. That needs to be a wake-up call for us. I believe in some ways that it was, but we really need to look at that as a wake-up call as we are preparing for our new future and how we address our relationship with our communities and the medicine and public health system. How can we gain trust, and how can we prevent some of the things that we saw happen early in the pandemic?
All right. Well, I will take you up on your offer and call you Dr. Jazz.
Yes.
Chief Medical Officer. Say your title again. Chief Medical Officer in the Bureau of
Community Health Promotion.
Community Health Promotion. We really appreciate your time. I know you're very, very busy, and so it's really wonderful that you're able to come on here and talk to our audience and get them up to speed on everything that's happening.
Well, thank you. Level. Thank you so much for hosting this space. Invite me back anytime. We could talk about any topic anytime. Just invite me back. And I just want to say to everyone who's watching, this has been a difficult year, but just stay encouraged. We are going to get through this together. And thanks for taking the time to listen today.
Thank you so much. And thank you, Dr. Jasmine Zapata, for joining us today. And thank you for tuning in and listening and watching along. If you understand, as you do, if you're watching this long, you understand that this is important. News is important. And hearing from people like Dr. Jasmine Zapata at the State Department of Health Services is important to keep you informed about this, all of this stuff that's been happening. All of this, it's free to you, but it's not free to us. Like, we didn't pay Dr. Zapata for that, but all the internet access, the camera, me, everything costs money. You know that. And if you would normally subscribe to something like Madison365 for $5 a month, $10 a month, $20 a month, think about making that a donation instead so that we can keep this free for everybody else. Okay. Madison365.org/donate. All your donations are tax deductible. We are a legit 501c3 nonprofit. All right. That's all the asking for money I'll do today. Have a wonderful evening. And thank you again to Dr. Jasmine Zapata for being with us. Have a great evening. We'll see you again tomorrow.
This is 365 Media.